Chasing Zero, Winning the War on Healthcare Harm. Introduction. Chasing Zero is a documentary shot by the Texas Medical Institute of Technology, a research organization whose main aim is the safety of patients. The documentary is hosted by Dennis Quaid, a featured actor who advocates for safer medical practices in healthcare. Dennis Quaid shared a personal story of how his newborn twins nearly died due to the wrong medication. Medical errors are one of the leading causes of death for thousands of Americans. The film tells the sad stories of families affected by medical mistakes and how patients and healthcare providers work tirelessly to reduce preventable deaths. Discussion. After watching the documentary, I learned that medical errors are caused not solely by caregivers' lack of concern for patients but also by flaws in hospital systems. Improving existing processes and systems or creating entirely new ones is the most efficient strategy to reduce medical errors. In order to win the war on healthcare harm, hospital leaders and staff should focus on the flawed systems within the medical settings. Patients are integral to healthcare, so their input is required and valued. When service users and the hospital have a good working relationship, there is hope for safer healthcare. As a result, patients should be reminded that they have the right to speak up and ask questions. What surprised me the most was that healthcare professionals were not reaching out to their patients and families after tragic events. I find it unprofessional and an indication that the medical staff did not care much about the well-being of their patients. The documentary is informative, even though the stories shared were heart-wrenching. Although hospitals are considered the safest place to seek care, there is no doubt that nurses and doctors can sometimes make mistakes. Conclusion. Leaders of medical institutions should stop denying their failing systems and start to invest in safe practices and technologies to win the war on healthcare harm. For example, a plan should be put in place to address any medication errors. With good leadership and safe practices, I believe there is hope for preventing accidental deaths and increasing patient safety.